So today's module is talking with young people and for out-of-home care providers in the context of the COVID-19 virus. And today's module is module 3, responding to behaviours of concern. So in starting, the Centre for Excellence in Child and Family Welfare acknowledges the traditional custodians of the land on which we work and live and recognises their continued connection to land, water and community. And the Centre pays our respects to Aboriginal and Torres Strait Islander elders, past, present and emerging. And we also recognise the Aboriginal sovereignty of the land and that this land was never truly ceded. Okay, so we're going to just start off with some housekeeping. So Oliver, whose voice you would have heard in the background, is from the Centre for Excellence and he's moderating today's session. And people are being very quiet, but we really encourage people to contribute. And the way that you can do that is through the chat function. And there's a little chat button that you should be able to see. And you can also use the chat. If you're having any technical difficulties, you could also send a message to Oliver. He may be able to help. But use the chat to ask questions or to make comments. And the other thing, because we've got only 16 people, it's really great if people give your views, especially share your experience. I think in times of isolation, it's really helpful for all out-of-home care providers to hear what other carers and providers are experiencing. So feel free to speak and you just unmute yourself to do that. And we're also going to have polls. There aren't 4 in this session, but we have a few polls that'll come up on your screen and we ask you to share your responses. The polls that you'll see on your screen are completely anonymous, so we can't see who's answered in which way. It's just a way of kind of getting a sense of people's experience in the room. And the other thing about today, the information that you receive is a guide only, so we really encourage people to go to the relevant websites that are at the end of this module if you really want to get the most up-to-date and recent information. And the reason I say that is because we know government are continually looking at the situation and regulations and policies are changing all the time. So I'm not a doctor, so we want to make sure that you get the right health advice from the right websites where there's specialists that are giving advice. Okay, so the modules. So some of you may have participated in the first 2 modules. So module 1 was fairly general. It was about how young people may be impacted by COVID-19. The second module focused on intersectionality and additional considerations in working with young people. Today's module is responding to behaviours of concern. And the final module on Thursday is talking with young people about family and community, trauma, suicidality and hope. And all of the modules are available on the Centre's website. So if you missed one and you want to have a look, you can go to the website and watch the audio and the PowerPoint again. Okay. So, as I said, really this module today is the 3rd of the 4 modules, and each module provides guidance and suggestions for carers of children and young people between the ages of 10 to 18 years in out-of-home care during a crisis, and references are provided at the end of this presentation. And I also really want to acknowledge the work that carers in out-of-home care do. I think in thinking about these modules, the work that you do in this particular context of COVID-19, where there's social isolation and where the world has changed so much. So you're probably dealing with your own issues around your friends, family and community, and self, being in isolation and cut off from possible supports, that you may have had access to pre the virus. And I just think also caring for young people who also have their own issues at this time, it's just a really big job. So I just want to say how much myself and the Centre for Excellence really appreciate the work that you do. And I think it's often undervalued and unacknowledged work. So particularly want to acknowledge what you do. Okay, so we're going to put up a little poll now, just as a bit of an introduction to today. And the poll is, what behaviours of concern have you noticed individually or collectively? And then we're going to have a little bit of a chat about these before we go into the presentation. So I'm getting Oliver to do that now. Great. Okay, thanks. So everyone can see the poll results. And it would be, I mean, looking at it for me, I guess the ones that are really highly rated are particularly absconding, which 61% of you have noticed as a behaviour of concern. And close behind that is non-compliance with social distancing. It's reassuring to see that no one has noticed self-harm or increased self-harm, which doesn't mean it's not occurring with other carers, but that's positive to notice, just because we know that there is an expected increase in self-harm and suicidality just because of the context of the virus, and that's across the board. So I'm really interested for anyone just to say something about why you noted those particular behaviours of concerns, just to share your experience in your context. And all you have to do is unmute yourself and speak. And the reason I'm saying this and really asking people to join in is because it's just really helpful for each of you to hear a bit about what other people are experiencing.
You can just press spacebar to sort of to unmute yourself if you'd like to say something.
I guess for me, Joe, this is Ben in Warrnambool. I put down absconding. I worked at it's called a contingency house with kids in between foster care.
Okay.
So I've done a couple of shifts there, and I just noticed if a young person is using substances, they will tend to abscond in order to go and obtain what they need. So that was one of the things I noticed.
Yeah, no, thanks for sharing that, Ben. And actually we cover that because in thinking about absconding, of course, if a young person is substance using, the only way they're going to get that substance is through absconding. And of course, you know, there's a whole lot of concerns around absconding, around substance use and around breaching government regulations and the consequences of that. So thank you for sharing that. Anyone else want to comment?
Yeah, hi Joe, it's Lynelle from Uniting Wimmera. Yeah, the absconding is related to the substance gathering, so to speak, in both a residential, therapeutic residential and a contingency. But we have had some positives too in one of our 2-bedroom therapeutic homes where both the young people obtained jobs at takeaway, so Hungry Jack's and McDonald's. So we've had some positive outcomes too, which has been great to see the kids grow.
That's fantastic to hear, because in the context of the virus, we often hear the negative stories. So that's really good news of 2 young people. That's great.
Yeah, absolutely.
Really
it was a little bit daunting to think, oh, they're going to work. Oh, is that, putting us all more at risk? But really, I think we're pretty well blessed here in Horsham, being so far away from the cities, I guess. So, yeah.
Great. Thank you, Lynelle. That's great. One other person? It'd be interesting, actually, 5 people talked about non-compliance with personal hygiene. I'm a bit interested to hear, was that the case before the virus, or have you noticed any changes? Is it because you actually wanted more attention to personal hygiene than previously? Or, yeah, it'd be interesting if someone could comment on that. Anyone? No. Okay.
I might just mention something that it's been a big issue with fines and sort of for kids absconding.
Yes.
If you wanted, yeah.
Yeah, we're going to talk around that through today, and I think the last session we also spoke about absconding, but obviously there's the legal consequences of absconding as well, and gathering in groups and breaching social distancing. All right, well, look, thank you everyone for participating in that. Again, I'll encourage you throughout today to share your experiences and any strategies that you have found useful in addressing any of these behaviours of concern. Although I'm going to cover them, it would also be great to hear from people at the coalface. So feel free to jump in, especially because we're quite a small group. Okay, thanks, Oliver. We'll take that poll down and move on. I have to get it off my screen. Okay, so module 3, responding to behaviours of concern. So just to look at the learning outcomes for today, at the end of today, participants will understand the issues specific to young people in care and including absconding. We're going to talk about ways to speak with young people to enhance compliance with government regulations. We're going to look at speaking with young people about harm minimisation, and that's specifically in the context of absconding in order to purchase substances, and also to responding to questions young people may have. And I guess within that context, carers need to be mindful that you can only do the best that you can. So there is no magic solution to the behaviours of young people. And it's to acknowledge that you already have a lot of skill and expertise in talking with young people. So, yep, you can only do the best that you can, but to share your experience today will be really helpful, because some of you will have used strategies to address these behaviours that have actually worked or at least made a difference. So yeah, please feel free to share. And I just remembered that I forgot to introduce myself at the beginning. So my name's Jo Howard, and I'm presenting on behalf of the Centre for Excellence. And my background is social work and family therapist. I've worked across lots of different sectors, most recently child and family services, also kinship care. I've worked in drug and alcohol, youth mental health, family violence and family counselling, and I've worked in remote New South Wales as well as in the city. So I always like it when I'm working with rural or regional people, because I think the context is really different from that of the city. Okay, so we're going to talk about absconding now. So practitioners working with young people in out-of-home care face many additional challenges, and one of these is absconding. And of course, the consequences of absconding can include that the young people is at risk of infection, that the young person's behaviour supports the spread of the virus and potentially infects others, that the young person may breach government guidelines, including self-isolation and social distancing, that community members and or the police may be abused, intimidated or assaulted for taking action to address the breach, and young people may face official warnings, fines and the youth justice system as a consequence of these behaviours. So of course, we'd rather that young people didn't abscond, But given that some will, despite our best efforts, we need to make sure that they're equipped with as much information as possible to minimise the risks to themselves and to others. And of course, it's important that young people are aware of the risks of absconding, and including, for example, purchasing goods such as illicit substances. So it's important that young people fully understand the risks and that they understand the government requirements and legislation, and also to be of the changes as they occur. And we know, that, with all the evidence about what makes a difference in changing or moderating young people's challenging behaviours is the relationship between the young person and the caregiver. So that's the most important mechanism to support behaviour change, because we know that for young people who've experienced trauma or who have attachment issues, that relationship becomes absolutely primary in terms of shaping the direction that that young person's life takes and in influencing behaviours, so positive behaviours and negative behaviours. And for this reason, the practitioner in the out-of-home care context who has the most positive and productive relationship with a young person should be the one to speak with a young person about their concerns. So I'm just going to pause again now to check with you participants just around what I've just said around the relationship, to hear any comments, any questions, or any examples where you've actually noticed that the relationship you have with young people has been a productive way of fostering behaviour change. So would anyone like to comment? Please do. Or put something in the chat box even. Nobody?
G'day, Joe. It's Ben again
Good
from
on you, Ben.
Nimble.
Yeah.
I'll just let you know who I work for. I work for Brophy Family and Youth Services. So my primary role is youth homelessness. So in terms of what you're talking about, relationships, sometimes, they take a good amount of time to create and create a positive relationship. So I just find with a few of the younger people I'm working with, over time, when you develop a bit more trust and rapport with the young person, they're willing to listen. So I mean, I think it's pretty well known that if you have a good relationship with someone, they're willing to listen to you. So it's not always easy to create with a young person, but I just find with a few of the young people who I've got good relationships with, because of a bit more time, that they're willing to stop and listen to what you've got to say, even if it's something that may contradict what they're thinking. So yeah.
No, thanks for sharing that. That's really good to hear. And yes, it does take time. And it is interesting though, because I mean, we can talk about things like giving them all the information that they need around the virus and the regulations, and that's what we covered in Module 1. But essentially, if you don't have the relationship and that trust or mutual respect, then they may not take any of that on board. And Vicky's just made a comment. She said the hardest part of building relationships with young people is difficult when staffing is changing and it breaks the child's trust within the system. Absolutely. And of course, the government review of out-of-home care really pointed to that given we know that young people have experienced trauma and attachment issues, that it's vitally important in supporting them to have that continuity of relationship. That's the one key thing that's absolutely going to make a difference to the trajectory of that young person's life. But our system, for a whole lot of reasons that you would be aware of, it can't support that recommendation at present. And of course, staff also have their lives to lead, and maybe they move or they get another job. So, but absolutely, building relationships is tricky in that context. So thanks for sharing that, Vicky. Anyone else just want to say anything about relationship and relationship building before we move on?
Yeah, Joe, again, Linnell from Uniting in Wimmera. We had to develop an isolation roster for our houses. Currently, we've got 5 separate placements, being 3 contingencies, and 2 therapeutic homes. So we have quite a big staffing range, and it's with the isolation roster, it's put staff in specific areas, which we have found has built better relationships. So 100%, what you're saying is so true. The consistency is the key to the therapeutic work we do, and it really has, you know, shone through this time.
Okay, so in a way, because of the COVID and the changes you've had to make, you've actually found it's actually enhanced the response to young people. Is that what you're saying?
It has, yes.
So it's almost like an unintended consequence in a way.
Yeah, pretty much.
Yeah. Well, but that's great to hear. Do you think that will be able to be sustained post-virus?
I'd love it to be, but you know, you've got permanent staff that have permanent rosters that have only just been changed for this situation. So it'd be tricky, but it's worth, and we do have therapeutic specialists that work with us that do note this too. So it'd be, yeah, something that everyone would want to have and be on board with as well. And going back in my resi work, which I was a residential practitioner for 7 years and then became a house supervisor. When we had a strong, solid team that was consistent, the house did run, the 4-bedroom house did run a lot smoother. So yeah, I have noticed that.
Yeah. Thanks, Linnell. That's great to hear.
No worries.
Okay, I'll move on. So I guess in terms of reiterating really the key messages that we want young people to have, to practice good hygiene, to practice social distancing, to follow the limits for social gatherings, and to understand what social isolation means and when it might be necessary. And one of the things I think is particularly important to note, and that young people may not be aware of, and it relates to the issue we were talking about before with absconding and purchasing substances. And young people may not be as aware that the virus can be transmitted from substance to substance transmission. So, for example, if a young person is receiving goods, for example, substances, drugs, whatever those substances are packed in may actually be a means of transmitting the virus. So when you're talking to young people around protection, you might talk to them about face masks, or you may provide them. You might talk about social distancing and using sanitizer before and after they score. So actually, that's just an important thing that hasn't been highlighted, I guess, in government regulations around that surface-to-surface transmission in terms of scoring substances. So we're going to move on, I think, to talk about harm minimisation in a minute. We'll talk about that more. But what I want to go into now is there's actually a fantastic series of 3 videos, and I'm going to show one of them. They're actually made in Australia, and the website's at the back of the presentation today. But it's actually speaking about young people in care and their trauma experience. And the video is particularly around the context of young people in care who've experienced trauma, having difficulty controlling emotions and impulses. And so it talks about the research that tells us learning to manage emotions is, again, based on the availability of support, coaching and trust from caregivers. So again, it's about the relationship between a caregiver and a young person as an agent for change. So we also know that active listening and focusing on feelings that are driving the behaviours will assist these young people to develop healthy and adaptive strategies to cope with the past. So we're going to spend, it's 15 minutes, which is longer than we usually show a video for, but I've obviously seen it myself. I think it's just such a good video. So we'll play it. We're going to have a little break halfway through and have a bit of a conversation, then show the rest of it. So over to you, Oliver.
And this is the third of 3 short videos looking at the needs of the children that we look after. These are children that have usually experienced abuse, neglect and other forms of trauma. In the first of the videos we looked at the first core need, which is the need to feel safe. We looked at different aspects of that need to feel safe, the need to be physically safe, emotionally safe, socially and culturally safe as well. In the second of the videos we looked at the need for healthy connections, and that includes connections with the normal community. So much has happened to these kids in their lives, and they often don't feel normal. So I think it's important that they are connected with normal people, normal activities, and so they can start to feel normalized as well. And these kids also have a need to be connected with the adult caregivers, because we know that their experiences have led to them lacking trust, particularly in other adults, and the need to establish trust-based connections with adults is a critical one. We also talked about Lisa, a young kid that when I was a house parent we used to look after, and she came into care about 12, and when she was about 13 there was this incident where she went out and got drunk. And our responses to that incident entirely missed the meaning of her behaviours, what was driving the behaviours, the emotions behind it. Instead of focusing on what her needs were, we focused on trying to correct the behaviours. And so we're looking today at the third core need. I want to start with just looking at some of the research on the needs of kids in care. We know that being exposed to trauma, especially early in life, can lead to problems in many areas of development. For example, we know that development can be affected in the following ways. We know that attachment can be affected. We know that social skills are problematic with these kids. We know that their physical health, especially over their lifetime, will be more problematic than kids who haven't been exposed to trauma. We know there's a difficulty around the control of emotions and impulses, the control of behaviours. We know that thinking skills can be affected. Things like self-concept, self-belief, shame and guilt are affected, and many of these kids lack a positive view of the future. But there's one of these areas of development that really stands out from the others. One that has sometimes been called the core experience of trauma. And I'll just read what 2 of the experts in the field say. So here's Alan Shaw. He says this: the most significant consequence of early trauma is the child's failure to develop the capacity to self-regulate the intensity and the duration of emotional states. And Bessel van der Kolk says this: at the core of traumatic stress is a breakdown in the capacity to regulate internal states. So what does that mean for us that are looking after these kids? Well, often it means that a little bit of frustration quickly becomes a rage. It could mean that a little bit of sadness becomes despair. Fear, a little bit of anxiety becomes a fear or even a terror. Moods can swing up and down, can be triggered very easily, negative moods. And sometimes feelings like loss and shame overwhelm the kids. They have difficulty regulating, keeping emotions in balance. Some kids cope by clamping down on feelings, shutting them down, building impenetrable emotional walls so that they don't feel vulnerable. You'll sometimes hear older kids say, I've learned not to feel good. I've learned not to trust others. Or I won't allow myself to love someone. It's part of this being emotionally protective. So managing emotions is a key issue with kids in care, but so is managing all the other impacts of trauma. The emotions, the thoughts, the feelings, the sensations. So much so that Louis Cozzolino tells us this about kids in care. He said, the traumatized child is drowning in a sea of fragmented and overwhelming emotions, sensations, and frightening thoughts. So how do children cope? Well, I'm sure you'd be familiar with some of the ways that children cope with overwhelming inner turbulence. For example, sometimes they avoid contact with the caregivers or anything that reminds them of things that they're afraid of. Sometimes they withdraw. Sometimes they cling to the caregivers. Sometimes they seek to control interactions and decisions and things that involve them. Sometimes they retreat into fantasy. They sometimes get aggressive, for example. And as kids grow older, they have more things that they can do. Some of them are helpful, some of them aren't helpful. But some of the things we grapple with kids, like we grappled with Lisa, are things like the use of substances as a way of coping. Some of these kids are more able to run away, for example, and not stay engaged. And others self-harm and use that as a way of coping with overwhelming feelings. It comes down to a way of seeing. Are these problem behaviours, challenging behaviours, bad behaviours, or are they ways of coping? Sandra Bloom, who is one of the great figures in the field of trauma, tells us this. She says the things we call symptoms or behavioural problems are the best solutions our children have been able to come up with to help them manage unendurable feelings. Whatever they are doing, it is, or at least it was, a useful coping skill, which over time may have become maladaptive, that's not helpful, or may have become a habit. So how can we help the young people we care for develop helpful and useful coping strategies that won't do harm to them in the longer run? Well, there's a couple of points. The first point is this. The research tells us very clearly that learning to manage emotions is much more to do with the availability of support, coaching, and trust in caregivers than it does to do with the personal effort of the kids involved. It's very, very difficult to learn how to manage turbulent emotions if you don't have close and warm and attuned support from your caregiver. So that's an important thing, an important principle to bear in mind. There are two very basic strategies that we can use to help kids manage with internal turbulence. The first has to do with a skill called active listening. Now, I'm not going to go through active listening. I'm just going to talk about one component skill, which the research is telling us is very, very helpful with children. And it is to do with the naming of emotions. If we can actually put a name to the emotional state of the child, we can help them deal with emotional stress. The research tells us that naming a problem emotion actually reduces the intensity of that emotion. For example, you can say something like this: I see that you're feeling very angry with Martha at the moment. Or, you seem sad that your mum didn't come when she said she was going to come. It sounds simple, but just giving a name to the emotion reduces the intensity of that emotion. It's even better if we can encourage the children to name the emotions themselves. For example, what were you feeling when your mum didn't come? Or were you sad or were you angry when that happened? And in that way encouraging the child to reflect on what's happening internally and put a name to it. As I said, it sounds simple, but the research is telling us that what happens in the brain is that the threat detection system in the brain starts to calm down when a name is given to the emotion. There's a second way that we can help kids that are really struggling with difficult emotions, thoughts, and impulses. And it's what parents do with small infants. Parents lend their calmness to the child when the child has run out of the ability to control the emotion. They don't use threats, they don't use consequences. What they do is try and understand what is motivating the behaviour, and then they try to address that need. Instead of making the kid feel more stressed, they use calm tones of voice. They use their physical presence, and they do what they can to reduce the intensity of the emotion rather than increase the intensity. Unfortunately, as children get older, we start to do the opposite. When children are upset or they start swearing, they start perhaps kicking things, really struggling with containing a difficult emotion. Our instinct is to start directing them, telling them they've got to stop this behaviour, and if they continue the behaviour, there will be a consequence for it. We call that coercive regulation. In other words, the adult is trying to control the child. And it's the opposite to what a parent does with a small infant, which is co-regulation, is working together with the child to calm down. Let's return to Lisa. If you remember that when Lisa came in, my instinct was to tell her off, to lecture her, and to give her a consequence for her bad choices of behaviour. Instead of focusing on the emotions that were driving what she did. In the following slide, we can see the difference between coercive regulation and co-regulation. Co-regulation involves a two-way engagement, not just a one-way intervention. With coercive regulation, we just focus on behaviours, like we did with Lisa. With co-regulation, we focus on the feelings that are driving the behaviour. With coercive regulation, usually the tone of voice is quite different, the non-verbals. For instance, just the harshness of the tone, because we're ordering the child or we're wanting them to stop doing what they're doing. But with co-regulation, we make an effort to speak in a soothing tone. It might be assertive, but it's soothing. It helps to calm the child. With coercive regulation, we sometimes retaliate to the child's hostility. We tell them, don't speak to me like that. But with co-regulation, we absorb the child's hostility. In other words, we don't focus on the hostility, we focus on what can we do to help them calm down. And of course, at the end, we're looking at meeting the child's need, providing support to the child, whereas with coercive regulation, we're not particularly interested in what support the child needs. So there's a big difference between being coercive with a child and co-regulating with them. Sometimes firm boundaries are needed. Sometimes a kid has just learned a bad behaviour. Sometimes it's a bad habit. Sometimes they might just be following what other kids are doing. Sometimes clear boundaries will need to be set. That's usually where the child is doing something that's unsafe or that will be harmful to the child or to other children. Bessel van der Kolk says, some children will one day need therapy. Some may be able to face doing formal therapy, some may not be able to face formal therapy. Bessel van der Kolk says this, the first order of business is to find ways to cope with feeling overwhelmed by sensations and emotions associated with the past. So we've now looked at the 3 core needs. Of course, these aren't all the needs that children have. They've got many, many other needs, and they've got needs that are similar to all other children during development. But these are the 3 core needs, and they're the 3 core needs that are associated with the experience of trauma. And just to review, the first one is the need to feel safe. The second one is the need for healthy connections, connections with the normal community and connections with caring adults. And the third need is to be able to find healthy and adaptive ways to cope with overwhelming feelings from the past. So I hope that this quick review of the 3 core needs has been helpful, and I wish you the very best in your vital work with these vulnerable children. Thank you.
Thank you. Okay, so obviously I thought that video would be helpful just because it's particularly talking about working with young people in terms of emotional regulation, and we know, as Howard says, that emotional regulation and difficulty with emotional regulation is one of the key challenges for young people in care. So what I'd like to do now is again open up to the group for any comments on this, and particularly as it applies to your work with young people in the context of COVID-19. Anything from that little clip that resonated with you? Anything you've tried? And particularly around the difference between that coercive regulation and co-regulation that Howard Barth spoke about. So hopefully people will have some comments. You can put them in the chat box, or you can unmute yourself and just share it with the room. Okay, over to you guys.
Jo, it's Davina.
Hi, yeah.
Hi, I just want to, I suppose, first of all, let you know, I'm not actually a youth worker. I work for an organisation that recruit and trains youth workers. So I'm new to the organisation.
Mm-hmm.
I've been in the sector for a number of years. However, this sort of information is very helpful to me. I'm in the process of developing some online induction processes for our new team members.
Right.
So this sort of stuff, and obviously COVID being an unusual event, an unusual environment, but definitely, so I'm in the middle of also doing my Hope and Healing framework training, which is a Queensland requirement. So, and just this constant, we're hearing a lot around the feeling safe, the connections, all that sort of stuff. So for me, it's I suppose I'm learning a lot at the moment as we go through. I'm not going to be contributing to, I suppose, any experiences as such, but I just wanted to put my 2 cents in and say, look, that although I'm not saying much, I'm here, I'm listening, I'm learning, and hopefully this is going to help us to train our youth workers in the right way going forward. So
right. No, thank you. Thanks for sharing. That's great. And look, I really recommend the other 2 videos you can get from the website. It's great to have some Australian perspective as well. So you might...
Absolutely. I actually wrote that down, that you guys, so to make sure that I get hold of his website when you at the end of the presentation. So thank you for that.
Oh, that's good. Okay, thank you. What about other people? I mean, just your thoughts in terms of how the strategies that Howard spoke about might be helpful in the context of the COVID-19 crisis. Be great to hear from others. Does any of it resonate? Just have to unmute yourself, please.
I feel like I'm on all the time. It's
that's great.
This, I was trying to send a message, but I'm a little bit unsure if it goes through or not. Anyway, this sort of work that we do in our workshops with therapeutic crisis intervention. It's a model that we follow. And it seems to be the exact of what
Howard,
thank you, was talking about. Yeah. Yeah.
Right. Okay. That's good. I think, part of the reason I thought this little DVD would be good is, I imagine for people, you people working with young people in this context, that there'd be that kind of tension between the therapeutic work that you do, that kind of co-regulation, but also being so aware of the COVID context where you absolutely want to minimise young people being at risk to themselves through catching the virus or through breaching government regulations and getting fined or whatever. And how do you hold that tension between, in a way, being coercive and saying, well, no, you must do this or you can't do that, with the kind of therapeutic relational work that you're trying to foster. And that's where I'd really like to hear from people.
This is Ben again, Joe.
Yeah. Thanks.
I guess you got to be a bit careful, about being too coercive.
Yeah.
I think a natural reaction for a lot of young people in that situation is to rebel. So, so the co-regulation is an excellent way. Not that I consciously use it, but we find that we do use it a fair bit, and it can also get the young person to, instead of being confronted with co-regulation in terms of absconding, like we spoke about before, when someone returns, a young person returns, it actually helps them to talk about other feelings as to why they absconded in the first place. Like you may think it's just to get substances, but there's a whole lot of other stuff going on there, like a feeling of loneliness, not being in contact with their friends, that really, that feeling of isolation they have, even though they may be in contact via phone, etc. It's not the same. No. So yeah, that's where that co-regulation works well.
Yep. No, thank you. Thanks a lot for sharing that, Ben. And I think, one of the things that resonates for me is, if you're a carer, to also reflect on your own emotional space, because as well as focusing on where the young person's at, we need to focus on what emotional responses the young person's behaviour is generating in ourselves. And for example, if they are absconding or they're increased substance use or self-harming or any kind of challenging or difficult behaviours, that can generate a frustration or anger or irritation in ourselves. And we need to be aware of what we're feeling in order to manage our own emotional responses, so that we can continue to be emotionally present and responsive to the young people with whom we're working. So yeah, I really wanted to make that point as well. I think, as I said in the very beginning of today, with out-of-home carers are dealing with their own stuff in relation to the virus, and they really need, you need to be really mindful of the emotional impact on yourselves of the young person's behaviour in order to be able to work within that kind of co-regulation framework that Howard spoke about. Okay, any other last Go on, sorry.
Yeah, I have one. I work, my name's Melissa. I work in leaving care, post-care sort of services, and I sort of see that period where young people are already feeling that they're pushing away from their carers or a lot of their other workers, and already sort of being, I guess, because the older people get, sometimes there is a tendency to use those more coercive, like, you need to do this because now you're going to be an adult, and which is an expectation we put on care leavers at quite a young age. But I think some of them that have already been feeling that pushback against the service system, this COVID-19 has caused them to push back even further.
Yeah.
There's a lot of the people around them feel there's no choice but to put these messages on them.
And yeah, no, thanks for sharing, Melissa. Do you think it's a bit of almost a bit of a tightrope kind of context in trying to hold that balance between being emotionally present and validating feelings and also having to kind of force, in a way, the government compliance?
Yeah, absolutely. It's difficult, and it's going to vary from each young person. And like you said earlier, the relationship with the young person is what will really help you to manage that tightrope.
Yep, great. Thanks for sharing that. Anyone else before we move on? I love it when people talk. And, you know, one thing that we've had from the evaluations of the other two modules is people have really enjoyed hearing other participants' experience. So that's also another good reason to share or to ask questions or make comments, is because it actually helps the other participants. So, nope. Any others? Okay, I shall move on. Now we have a little poll again, so I'm going to get Oliver to put that poll up. Oh, he has. So Oliver's put up a poll just around some of the coping strategies, and our question is, what are some of the positive coping strategies young people in care have used to cope with impacts of trauma? So it would just be interesting if people can fill this out. Great. So you'll see the results on your screen. 82% of participants said young people use music, which makes sense. It's interesting, yoga and meditation have only one response each. And but in my work that I've done with traumatised young people, it's interesting because, of course, the evidence is really clear about the value of meditation and yoga, but it can be really, really hard when you're working with traumatised and stressed young people to actually get them into a headspace where they can engage in something like yoga and meditation. That's been my experience. Some young people will say, you know, that's crap, I'm not doing that. And they're not willing to give it a go, or because they're so emotionally activated, they find it really difficult to engage with yoga and meditation. Nearly 60% of you said exercise, which I'm a really big advocate of exercise, because we actually know that the physiological impacts of exercise absolutely help to reduce the negative impacts of trauma. And 20% of you said mindfulness as well. So one thing that I would like to point out, I do a lot of work around shame as an impact of trauma. And we know that most young people who have experienced trauma and attachment issues are carrying a huge burden of shame, whether they articulate that or not. And shame can be enacted through a whole range of things. For example, physical appearance, so, you know, eyes down, difficulty making eye contact, body posture. And it can also manifest in terms of low self-esteem, things like being clumsy, social awkwardness, and so on. But we know one of the biggest antidotes to shame is self-efficacy. So when young people feel they have done something good, that action and the response they get from their carer starts to minimize the impact of shame. So it takes a lot of time to fully minimize that impact. But the reason that I'm raising this is when young people actually are affirmed for complying with whatever regulations or policies and procedures you have around COVID-19, they actually gain a sense of self-efficacy that they've done good. And that actually starts to address the shame and the impact of trauma. So, for example, if you are focusing on personal hygiene and you can see or notice that a young person comes in and washes their hands or squirts a bit of sanitizer on their hand, then to note that, like, oh, wow, I really like the way you're using that sanitizer, is enough. It doesn't sound like much, but it actually builds a sense of self-efficacy in that young person. So as well as complying with regulations, you're actually responding in a way that starts to reduce the impacts of trauma. So does that make sense, what I've just said to people? Can someone tell me it does? Or write in the chat box, I'd like to hear from someone. Nope. Oh, good. Ben said it makes sense.
Melissa said something as well. Yes.
Oh, Melissa. Oh, yes, it does. Great. Okay, no, that's good. Thanks. So I think, you know, I'm really just trying to say that as well as looking at all the COVID restrictions and adhering to that, we can actually do it in a way that is trauma informed. Okay, so I'm going to move on. And now we're going to just talk about kind of a step back to look at adolescence. And I'm sure that you will probably already know what I'm going to tell you, but it's recapping. And someone, Glenda's also said everyone enjoys praise. And sorry, Vicky said that. So they do. Everyone enjoys praise. So using compliance with COVID regulations as a way of reinforcing positive self-regard is really important. Okay, so adolescence, as you would know, is a developmental stage that involves increased risk-taking. It goes with the territory. And young people impacted by trauma may have compromised emotional and psychological development. The other thing about trauma is that young people that have experienced trauma and attachment issues may lack empathy, which means that they are not mindful of the risks their behaviour poses to others. Because of course, if you have empathy, you're going to be concerned about the impact of your behaviour on others. If you lack empathy because you haven't experienced it yourself as a child, and because of the impact of trauma on your brain, you're not going to have regard for the impact of your behaviour on others. So of course, the importance of speaking with young people in order to minimise the risk cannot be overstated. But we also know that conversations with young people need to consider both chronological and developmental stage. So in terms of risk-taking, we know the frontal cortex of the brain, which is the part of the brain that helps people make rational and mature decisions, isn't fully developed. And we know it doesn't usually develop till about the age of 25. And it means young people may lack capacity to cognitively understand situations and make the best decisions. And young people that are impacted by trauma may have compromised emotional and psychological development. So they're going to be more prone to risk-taking and less likely to heed advice and follow guidelines. They can be impulsive, disregard authority, have lower impulse control, and have difficulty understanding the consequences of their actions and minimise risk to self and others. So it's important to realise that the kids who have been through trauma also lack a positive view of the future. And because they don't necessarily kind of have a view of the future, and particularly a positive view of the future, they're less likely to also take into account the consequences of their actions in relation to the COVID-19 virus. So with age and stage, we know that personality, biological influences, genetics, and the environment, and especially early childhood, can impact a child's or a young person's development. And that a young person's physical, emotional, cognitive, and psychological development may not necessarily be in line with their chronological age. So when we're speaking with young people, we need to account for their chronological age as well as their developmental age. So obviously a conversation with a 10-year-old about the COVID virus is going to be different from that of a 17-year-old. And a 10-year-old is going to have different needs than a 17-year-old in relation to the virus. And as well as that, a conversation with a young person with a developmental delay, for example, is going to be different from a conversation with a person of the same age without a developmental delay. So in having conversations with young people, we need to consider their capacity to understand the information that we're providing and their responsibilities. So it's important to ensure that we don't use too much jargon and that they understand the concepts we're talking about. And in Appendix 1 at the end of this presentation, we've got some definitions of the terms that are used around COVID-19. So it's important you can understand what these terms mean because you're going to have to translate them for the young people in your care. I've already said it's important not to use too much jargon and also to understand the differences in the types of information young people want information about. So for example, a 10-year-old might be more interested in getting sick themselves and what might happen if they get sick. Whereas a 15-year-old who's obviously going to be more interested in kind of peer relationships because that's a developmental milestone of a mid-teen, might be more interested in how the virus might affect him or her in relation to playing sports, for example. And a 17-year-old who is sexually active might want to know about any increased risks in having sex. For example, can I catch the virus through having sex? That might be a question a 17-year-old might ask. So at 10 to 14 years in general, young people are more worried about other people, for example, family members or friends. They require basic and easy to understand information, and you can be guided by them and the questions they ask. So they may be concerned about what happens, for example, if their carer gets the virus. They might find it difficult to grasp the terminology used in describing the virus and may need more support to allay any concerns and anxiety. So the sorts of information that they might require is, to describe the virus, it's a little bit like the flu, but it's much more infectious. To really give that message that most people who get the virus will recover and only some people get very, very sick where they need to go to hospital and where they may die. Again, that it's important to follow government guidelines because if we don't, that can lead to you and other people getting sick. And sorry, I just lost my slide. Oh, sorry, I've just had a little glitch. I'm just getting that back. Sorry, my computer's just doing it. Okay. Okay, so when we look at the older age group of 14 to 18 years, this age group might have different concerns from younger adolescents. And as young people get into older teams, they can become more self-focused. So they might be focused on how the virus will impact them than on others. And we also know that this age group, the risk-taking can increase, and particularly in relation to substance use. and they may be less likely to understand their vulnerability to the virus and the impact of their behaviour on others. So we also know, you know, along with risk-taking is that sense that young people may have of being invulnerable, that it's, you know, that kind of attitude, it's not going to impact me, I'll be okay. So at this age, young people start to develop their capacity for abstract thinking, and they may start to have strong moral codes which might impact how they think about the virus or how governments make decisions. But in general, they'll need more detailed information about the virus and how it's transmitted, diagnosed and treated. And also at this age, they may be more interested in how the global developments are occurring in relation to the virus. So they're less likely to understand their vulnerability and less likely to understand the impacts of their behaviours on others than younger adolescents. And this is just generalised. So they will require more regular updates and reminders to ensure they understand and comply with health measures. So talking to adolescents about self-care and risky behaviours in terms of contracting the virus is going to be really important. And at this age, young people might have greater concerns about how the virus might impact their relationship with their peers, including intimate partner relationships. What happens if they don't follow government regulations? They might be concerned about being rejected by their peers if they catch the virus, or being isolated from peers if they catch the virus. And that's going to be an important one, because you want to make sure that if young people in your care do start to feel sick, that they're actually upfront with telling you that, they're not hiding it. They will be interested in how the virus impacts sexual and other health longer term, and also, of course, whether their freedom and independence is going to be compromised by government restrictions. So I'm just going to pause there to ask everyone again, at what age group, I'd be really interested to hear what age group people think has been the hardest to deal with. And we're looking at between 10 and 18 years in terms of speaking about the virus, complying with government regulations or your own out-of-home care regulations. Again, it'd be great if some people spoke. Has anything that I've said about those age groups kind of rung true, or do you disagree? Great to hear about your own experience. So feel free to unmute yourselves and share, or put it in the chat box. Ben, you're always a good talker. Can I single you out? Or anyone?
Hi, Joe, can you hear me?
Yes, yeah. Who's this?
Oh, good. It's Barb.
Oh, great. Good on you, Barb. Thanks.
Yeah, I think those couple of slides really cover the age groups well, and yeah, it just shows the difference. Even though they're all basically teenagers, there's certainly a big difference between the early teens and the late teens.
Yep. What have you noticed in your own context?
Well, the children that I've been working with have mainly been like under that age, so like pre-teen. But you can certainly notice the difference. Yeah, with some other families that, yeah, the 18-year-olds or towards that end of the spectrum are all about themselves, whereas the 14-year-olds are more worried about their friends and themselves and their family. Yeah.
Great. Thank you for jumping in. I'd really like to hear from other people.
Joe, Linnell, I think we've got the 4-bedroom, the 2-bedroom, but what I've noticed is the 2-bedroom have better connections with their carers and more thoughtful of protecting their carers. They don't abscond, whereas the 4-bedroom, there's not as close connection there. So
that's interesting. Can you say anything around, have you noticed any differences in behaviours or concerns depending on the young person's age? or not?
It's more so, I guess, also in the 4-bedroom we have one that uses substance. Yeah, that's probably more so, but I just find that the children are more thoughtful with the connection.
Yeah, no, and that makes sense in terms of what we've been speaking about today about relationships. Yeah, thank you. That's great. Thank you for jumping in. Any other last comments before we move on? It'd be great to hear what people experience in terms of just even the chronological age of the young people you're working with. Nope. Okay, I'll move on in that case. I've got about 10 minutes to go. So let's talk about harm minimisation. And this is particularly in relation to the absconding and substance use. So we also spoke about this in Module 2. And as I said in Module 2, harm minimisation is a framework and a set of practices that minimises the risk of physical, social and legal harms that young people do to themselves and to society as a whole. So it's really about a public health strategy rather than a legal response to behaviours of concern. And it's absolutely mostly applicable to working in the context of drug and alcohol. And it's also highly useful in working with young people in out-of-home care. So in terms of harm minimisation for young people in out-of-home care, so it's really about considering the behaviours of concern, knowing they are going to happen. So knowing despite our best efforts, absconding is going to happen. Despite our best efforts, young people are going to go out and score. So some harm minimisation strategies might be things like issuing every young person with a face mask and or sanitizer, because it's in recognition that if they do abscond, if we can get them to sanitize their hands before they have physical contact with another person. For example, if they're scoring, handing over money, receiving goods, that's going to help in some way. To emphasize that if they do abscond, they need to be aware of social distancing. So again, we can't stop them absconding necessarily, but we can try to emphasize the importance of not standing too close to someone. To ensure they have access to social media, and possibly, I know some out-of-home care providers are allowing young people to have more time on social media in recognition that it's about keeping them, I guess, entertained and engaged, and also connected with friends and peers when they can't physically see them. And also, of course, we spoke about having the right information about how the virus is transmitted. So those are some of the strategies that may be helpful. Again, I'd love to hear from other people what you've tried in terms of harm minimisation. I'm sure there's other strategies. Is anybody going to share? Nope. No one wants to share what you've tried in terms of harm, or even have people in the audience actually used any harm minimisation strategies or thought about harm minimisation in terms of things like social distancing or sanitizers? Nope. Okay, we'll move on because we haven't got long to go now. Okay, so general principles in terms of talking to young people. I think what we saw in the last video with Howard is overall, despite how you're feeling, you need to really reflect on your own moods to be calm, because a young person's going to pick up on your own moods and emotions. So if you're calm, they will feel calm. So it's a little bit about managing your anxiety. Time and place is important. So consider the place and the timing for having conversations with young people. So when they're likely to be most responsive and receptive to conversations around compliance. to respect how a young person's feeling and what's of concern for them. And of course, we know some young people might be worried that they're asking stupid questions or they're overreacting. So they might find it easier asking questions or talking about the virus in a confidential space and in an environment where they feel safe, such as driving in a car or outside. Language is important. So if we use coercive regulation, we're going to use language like you must, you should. So we need to think about active listening, and to listen well, it's important to understand how the child you're working with views the situation and what's troubling or confusing him or her. So when young people can't name emotions because of the impacts of trauma, it can help for you to be able to name the emotions for them and to actually be able to explore what matters to them in terms of the COVID regulations and how you can use harm minimisation strategies and how you can get the message across in a way that privileges their emotions rather than using that kind of coercive control. Okay. Be honest, genuine and open. So don't try and sugarcoat the reality. So young people need to know that you can be upfront and they can ask anything and get a straight answer. So ignoring the issue won't stop young people thinking about it. It might even make them more anxious if no one's speaking openly about it. So show openness to discuss anything related to the virus. And also it's fine to answer, I don't know, because what young people and children need most is someone they can trust to listen to their questions, accept their feelings and be there for them. So don't worry about knowing exactly what the right thing is to say, because in some cases, there's no answer that you can give that will make the young person feel okay. The important thing is that the young person knows you are with them in what they're feeling and experiencing. You would know about body language, so using open body language, leaning forward, indicating you're interested. And I can't remember who it was, but someone before was talking about patience, and it takes time to build relationships. And it's the same in relation to the COVID-19 information. It might take time for them to process information. So you'll need to have multiple attempts and to also let them know you're available to speak to and ask any questions. And also to normalise their concerns and then check in. So let them know any feelings okay. Everyone has different concerns and feelings, and that's normal, okay. Different people deal with feelings in different ways, and there's no stupid questions. So some sort of responses might be, most people haven't gone through anything like this before. A lot of people are worried, and that's understandable. Or your emotions are a normal response to an abnormal situation. Or it's understandable that you feel anxious. Lots of people are feeling this way. There's a lot of uncertainty. Sorry, just lost. Can I ask you a few questions about your concerns? When did you first start to be concerned? What made you start to feel concerned? What's your worst fear? What's your biggest worry? So those kinds of reflective questions can be helpful. And Vicky has just sent a comment, which is a really great point. She said, I've found that when you have to admit to not knowing something can be an opportunity to look up the information together, which also helps to build your relationship with the child. That's a great comment. And that's a great idea, to actually not just be there to provide the information to the young person, but to actually work with them to find that information. Thanks for that, Vicky. To validate their concerns by paraphrasing what they've said and checking in. So it sounds like you're really worried about your brothers. Is that what's preoccupying you? Or it sounds like you're feeling really anxious, you might catch the virus. Is that right? Or you're worried about whether you can see your mum or not. would it help for me to explain how things have changed? We can work out how you can have contact using social media. Or you're worried about social isolation and how you'll cope. Have I understood properly? Or you're not sure how things might change while you're in care. It's making you feel worried. Is that right? And lastly, is there anything you wanted to talk about that we haven't covered? So they're the sorts of responses to validate their concerns and help them to name the emotions that they're experiencing. So we also know that many young people will have a lot of information about the extent and impact of the virus from Australia and Victoria and overseas. They may access social media that will give them misleading and inaccurate information. So it's also important to highlight that there will be rumours or conspiracy theories and myths. So the websites that are on your screen now can be helpful for you to make sure that you've got the right information. So finally, this is pretty much it for today, but we're just going to finish. If people can just join in and maybe say one thing each, it's share your positive experience, one thing that you've done in your role as carer to help a young person overcome trauma. And we'll get people just to hang in there for a few minutes, and hopefully a few people will respond. It's great to share what you've done in your particular context. Please.
Hi Joe, it's Barb.
Oh, good on you, Barb.
I've got a family of 4 boys that I've been working with, and one actually has like quite special needs, so they've found it a little bit difficult, like the homeschooling. So I've been a couple of days a week been working with him for an hour or so on his worksheets and stuff like that. And the other day he was a bit sort of not standoffish, but didn't really want to sort of do his work to start with. And then last week when I went around, we did probably like about 8 sheets. And then I said to him, okay, have you like had enough now? And he goes, no, do 2 more.
Oh, great. Yeah.
The week before, he would have tried to get out of it as soon as possible. So, just by having somebody being able to sit there and go through some stuff, and he could feel that he did it, and it was nice and quiet. There was only like the 2 of us there, like with social isolation still in place, obviously.
Yeah.
But yeah, so he could just sit and concentrate, and it worked really well. So over time, like you say, building up the relationships and just putting things into place to help them during this time was really good. Yeah.
That's great. Thank you very much for sharing. That's a lovely story to end on. And I am going to end because I can see people are leaving. So thank you so much for everyone. And Vicky's also added listening and respecting the child's opinion is important. Absolutely. So thanks for participating in today. There is a little evaluation that Oliver will give to you. We really appreciate you doing that. And Melissa's just added a comment that, how much young people appreciate a worker who really seems to care for them and gives them space to be themselves. So thank you all. We'll finish, and hopefully we will see some or most or all of you on Thursday for our final module. Great, thanks. Over to you, Oliver.